You are sitting in a doctor's office. The doctor hands you a small white pill. She says it will help with your pain. You take it. And it does help. Your pain gets lighter. You feel better. That is not surprising. That is just medicine working. But here is the part that should stop you cold. What if that pill had nothing in it? No medicine. No active ingredient at all. Just sugar and chalk. And your pain still got lighter. Your body still healed. How is that possible? This is not a trick. It is not a mistake. It has been measured, tested, and confirmed by some of the most careful scientists in the world. And the name for it is the placebo effect. A placebo is a fake treatment that produces a real result. And the more you learn about how it works, the stranger it gets. The first person to take this seriously in a modern scientific way was a man named Henry Beecher. He was an American doctor working as a battlefield medic in World War II. In 1944, near the town of Anzio in Italy, he ran out of morphine. Morphine is a powerful painkiller. He needed it for wounded soldiers about to go into surgery. Without it, the pain of surgery could kill them from shock. So a nurse, in desperation, injected a soldier with plain saltwater and told him it was morphine. And the soldier calmed down. His body relaxed. He survived the surgery. Beecher watched this happen. He could not explain it. But he never forgot it. After the war, Beecher went back to Harvard and spent years collecting records from hospitals. In 1955, he published a paper called The Powerful Placebo Dopamine. He had looked at 15 separate studies involving over 1,000 patients. He found that in roughly 1/3 of all cases, patients got measurably better from treatments that contained no medicine at all. 1 in 3. Just from believing they were being treated. That paper changed the way medicine thinks about healing. But here is where it gets even stranger. For a long time, people assumed the placebo effect was just in your head. Like you just felt better without actually being better. Then in 1978, 3 scientists at the University of California, John Levine, Newton Gordon, and Howard Fields, ran an experiment that changed everything. They gave patients a placebo after dental surgery and watched their pain drop. Then they gave those same patients a drug called naloxone. Naloxone blocks the brain from releasing its own natural painkillers, called endorphins. And the moment they gave the naloxone, the pain came back. The placebo had been triggering the brain to release real chemicals. Real endorphins. Real pain relief. This was not imaginary. It was biology. Your belief had reached inside your own nervous system and pulled a lever. Keep that idea in mind, because it goes even further than pain. In 2002, a surgeon in Texas named Bruce Moseley ran one of the most uncomfortable experiments in medical history. He had patients with painful knee arthritis. He divided them into 3 groups. One group got full knee surgery. A second group got a partial surgery. The third group was put under anesthetic, given small cuts on their knee so it looked like surgery, and then woken up. Nothing had been done inside the knee at all. 2 years later, all 3 groups reported the same level of improvement. The fake surgery worked just as well as the real one. The patients who got nothing but a scar walked better. They reported less pain. Their lives had genuinely improved. That result was published in the New England Journal of Medicine, one of the most respected medical journals on earth. So now you have to ask, what is actually happening inside your body when you believe something will help you? Here is what the science says. When you believe you are being treated, your brain does not just feel calmer. It starts issuing instructions. It releases endorphins, which kill pain. In patients with Parkinson's disease, a condition caused by the brain not making enough dopamine, placebos have triggered real dopamine release. Dopamine is a chemical messenger the brain uses to control movement. The belief alone caused the brain to make more of the thing it was missing. Neuroscientist Fabrizio Benedetti at the University of Turin has spent decades studying this. He found that the ritual of treatment, the white coat, the kind voice, the clinical room, the act of swallowing a pill, all of it sends a signal to the brain. The signal says, help is coming. And the brain, like a good employee who trusts the announcement, starts preparing the response before the help even arrives. Here is the twist that flips the whole thing around. In 2010, Ted Kapchuk at Harvard Medical School told patients exactly what he was doing. He said, I am going to give you a placebo, a sugar pill with no medicine in it, and I want you to take it twice a day. No deception at all. And the patients still got better. Significantly better than the group that got nothing. Even when you know the pill is fake, the ritual of taking it, the routine, the act of caring for yourself, that is enough to move the needle. Your brain does not need to be fooled. It just needs a signal. This is the thing worth sitting with. Your body is not a passive machine waiting for chemicals to fix it from the outside. It is an active system that listens to what you tell it. Not in a magical way, in a deeply physical, chemical, measurable way. When you believe care is coming, your brain starts the repair. When you believe nothing will help, it sometimes does not start at all. That is the other side of this, the nocebo effect, where negative expectations cause real harm. Patients told a treatment will cause nausea often feel nausea, even when the treatment is completely inactive. So the question is not whether your mind affects your body. It clearly does. The question is, what are you telling yours? Think about the last time you were sick and someone you trusted said quietly and calmly, you are going to be fine. And you felt, just slightly, a little better. That was not nothing. That was your brain receiving a signal and deciding to act on it. The white coat is not just fabric. The gentle voice is not just sound. They are keys that unlock something your body already knows how to do. Your belief is not separate from your biology. It is part of it. The fake pill works because the trust behind it is real. And that means the most powerful pharmacy you will ever have access to is already inside you, waiting for the right signal. If this changed how you see your own mind, hit like and subscribe. Every week on this channel, we go looking for the science hiding inside ordinary human experience, and this is just the beginning.